Okay. Okay, guess what? We're live. Excellent.
Nice.
So we'll give it a few minutes as people are getting on right here, but there we go. So I'm going to welcome everyone to this webinar. I really appreciate you guys being on here. I'm stoked about it. I'm stoked for two reasons. Number one, we just moved into our new office, and this is the first webinar that I've done from the new office, right? So if you're seeing the background right now, that's usually I have like a big sign up, and I have a lot of other things in my background. That's the reason why, is that we just moved into our new office. And the second reason is that we're going to be talking about something that I honestly did not know even existed prior to this whole pandemic coming out, and that was the concept of telehealth and how you would incorporate that into your business. So the topic of this presentation today is going to be the new reality for private practice. And we're going to have a guest. Of course, you can see the guest right now. His name's Dan Seidler. He is the CEO of TelePT Solutions. You can see that beautiful background that he has right there. He's really going to be our guest today to really talk about telehealth and how to, I think, properly incorporate that into your practice. So I'm going to start the presentation right now, and a couple things that I want to mention, because there are some people on here that probably you know Dan, but you may not know who I am. My name is Eric Miller. I am the Chief Financial Advisor for a company called Econologics Financial Advisors. Now, we specialize in working with private practice owners, and we show them how to better manage their personal finances so that you can create financial independence. That's what we do. Over the last 10 years, I've had over 10,000 conversations with practice owners, mostly physical therapists, veterinarians, dentists, chiropractors. And unfortunately, what I've seen over the last 10 years are a couple of things. Number one, I've seen owners not pay themselves what they're worth. I've seen them get overwhelmed by debt. I've seen them underfund their retirement, and I've seen them overpay in taxes. And we really created a system and a mission in our firm that we show and we guide owners and really enable them to reap the benefits of their practice. And we do that by creating a system where we show you how to run your household as the parent company. We show you how to put your profits first so that your business finally serves your household. So you can create multiple income streams, you can get out of debt, you can pay minimal taxes, but I think most importantly, you can leave a legacy. And I think that's what everybody wants to do. So that's a little bit about us. I'm going to pivot right now into what is the reality of what's going on right now. And when we look at what's going on in private practice healthcare, a couple things that I want to point out. I talk a lot about, as a business owner, you have three responsibilities. You have the practitioner role, the executive role, and the owner role. And the most important function and responsibility of the owner role is to make sure that the business is profitable, to make sure that it's sustainable, to make sure that it is there. It can stay there and function so that you can serve patients and you can deliver what your service is. From what I've seen right now, the patients are coming back. They're coming back rather slowly. I don't think that most of the practice owners that I talked to at least 3 yesterday, most of them are at about 50% capacity right now. Maybe some of them are a little higher, but they're definitely not anywhere near where they were. A lot of owners had to cut staff and cut their own pay. This definitely doesn't feel like normal to me, and it shouldn't be to you. But I think right now it's more important than ever, a couple of things, is that you have a very, very coordinated financial team that is around you. Why? Because I know a lot of you have probably taken some of these loans and are trying to manage your finances. And if you don't have experts around you that can help you explain that, then there's a chance that you can get into trouble. So definitely make sure that when you're working with or you put together your financial team, that you really have everyone coordinated with one another so that everyone's speaking the same language, and most importantly, they're all working for you. Now, speaking of that, one of the things that I've talked about for a long time with business owners is that you can't rely on one of anything. If you rely on one of anything, you're eventually going to lose everything. And I think a lot of us have finally started to realize that you can't rely on one income stream. You can't rely on, one key employee. You can't rely on just one of something. So what happened about 6 weeks ago is that it did expose a lot of things that were not in good shape for a lot of practice owners. I think we all realized that we did not have enough money in reserves. I think we all realized that we were probably overstaffed. We probably all realized that there were some inefficiencies in our business and that we didn't have enough income streams, and we weren't as profitable as we possibly could be. So when it comes to looking at where you're at right now and what to do, I think one of the things you have to start looking at is, how do I add additional income streams and services based upon what is the reality of the situation that's going on right now? So it says right here, you got to be flexible in this environment, and you have to be creative, super creative when it comes to looking at other income streams inside of your practice. And whether you're a physical therapist or a veterinarian or a dentist or a chiropractor or an optometrist, this all relates to you in terms of, your level of creativity to create other income streams. But that's your responsibility right now as an owner. You have to keep the organization there. You have to keep it solvent. You have to be able to keep enough money coming in. So you're going to have to get creative in looking at additional income streams. So to segue into that, I'm now going to introduce Dan. And I met Dan, I think we met on another podcast, or we met on a symposium, right? Yeah. So
early on.
Yes, exactly. Early on. And again, I had no concept of telehealth at all before this occurred. And when that concept, was introduced to me, I was like, wow, this is okay. This is something I've never heard before. So I think we reached out to each other and we're just like, hey man, let's do some kind of a webinar where we can get this data out to our clients and make sure that they have this. So I'll pass it over to you right now, Dan, and you can tell people a little bit about yourself and then what your specialty is.
Great, thanks, Eric. And at the time we were really talking about the Band-Aid stage of this. Yeah, it was like survival. What a practice is going to do to either keep their doors open or pivot and go straight to telehealth. And, at the time, most PTs, most practice owners really were not sure where they were going to go at that point. But a lot have put on that Band-Aid. Now we're starting to talk about the future, right? Now practices need to start planning for the future, like you said. So thanks, Eric. Thanks for the introduction. And thank you, Annette, for putting this together. And thank you all for taking the time to join us today. For those of you who don't know my story, I've been a PT since 1996. I was a practice owner for 15 years. We were acquired by a larger group in 2016. And at the time, we were doing 40,000 visits a year. And I was always looking for innovative ways to connect with patients and potential patients, existing patients and potential patients. So we had a wellness program. We hosted health fairs. I went to senior centers and did talks on managing arthritis and managing Parkinson's. And I always had my eye on telehealth because I was looking for ways to integrate telehealth into an outpatient PT practice. But at the time, I felt the technology was not quite up to speed. A lot of people didn't have broadband. We kind of just said put in broadband in our office. The Wi-Fi was kind of iffy sometimes, and I knew that patients probably were not going to have the technology to do it yet. So I was holding that card in my pocket, basically. After we were acquired, I eventually became the director of business development at the company, and with much persistence and persuasion and hoop jumping, I eventually convinced the executive team that the time was right and telehealth was worth pursuing. So late in 2018, they gave me the go-ahead, and companies at the time. And what I realized in speaking with each of them was that they had great technology, but they didn't understand how a PT practice works. So it was going to require some interfacing, because I also knew then, and to this day, that most PTs don't understand how technology works. So there is a gap there that needs to be bridged, and we need to help PTs understand technology understand PT, and put it all together. And that applies to most medical practices. I mean, I've definitely spoken with brilliant doctors who are not really even sure how to check their email sometimes, or get into a browser, or what the different browsers are, or what that even means. So, and that's not their specialization. That's not what they do. Not what all of us do usually. So my mission was to create templates, forms, models, policy and procedures, and a training program to implement company-wide. And the rest is history. So we launched in July 2019, doing PT, OT, and speech in 8 states. And needless to say, they were ready when they had to close 80% of their physical offices 2 months ago. I was no longer with the company at the time. I had left back in September. And I've been working since then with PT, OT, speech practices, medical practices of all sizes, mostly at this point getting through the storm of the first 2 months of this crisis and launching a new vertical for them in the most hectic environment any of us has ever experienced, right? So most of my clients are at the stage now where they're planning for the future, just like we were saying. We're not completely out of the woods, as you all know, but this is the time to start wrapping our heads around what the post-COVID private practice is going to look like and how we're going to survive and thrive in that new reality. So off we go. I don't know if I have control of the slides here, Eric.
Yeah, it should say next at the very bottom.
Okay, gotcha. I don't have that.
I'll just go ahead and do it for you then.
Yeah, that's cool. I can just let you know when. So everyone have your gear by your front door every time you're going to go out in public. It may not be as extreme as this guy, but it's a thing. Gloves, mask. And think about this. I mean, are you ready to go to a restaurant, the barber, the dentist? Hopefully sooner rather than later, but it's going to be different. And we have to be prepared. We, as practice owners, need to be prepared to offer a safe, super sanitary environment to our patients and clients in this new reality. Next slide, please. So there are lots of guidelines out there for how you're going to do this, and it's all very doable. This is for PTs and other professions, and each of these organizations listed here has their guidelines for doing things the right way. I happen to mention Brian Gallagher because I've worked with him a little bit, and he put together something very specific for PT practices, which is great. It's very concise, very easy to use. But the APTA has put something out. Each of the states has their guidelines. There's HIPAA guidelines, there's CDC guidelines, there's OSHA guidelines. You do have to create a safe environment for your staff as well as your patients. So those are all things you're going to have to consider. Like, think about your break room. What are you doing in your break room? I mean, these are things that each of us as a practice owner needs to put a lot of thought into to create a safe environment so that we can get things moving as immediately as possible. So I'm sure you realize like all this necessity and following these high standards in cleanliness and sanitary work environment, all that other stuff. And you've probably thought about the financial impact of these adjustments, including supplies, staffing, decreased production, right? Not to mention that some patients will still choose to not come into your office. And that's going to be a big challenge for everybody. So maybe it's out of fear, legitimate or not, or maybe it's because they've seen the light and appreciate the convenience and effectiveness of telehealth care in the past few months. And I think that that's a reality, by the way. People recognize that. Go ahead. What
percentage do you think, that are going to be just plain fearful of coming in to practices?
That's a great question. I don't know. I've certainly talked to a lot of people around here in the New York City area, and I have not found many who are eager to go back into their PT office or their doctor's office, or they're getting acquainted with telehealth at the moment.
Yeah,
they're very comfortable with it. For the foreseeable future, they're not going to be jamming into PT, chiropractor, medical offices very soon. And people do it. There definitely are. Look, telehealth is not for every patient, every visit. So right. There are definitely times when a patient needs to go into the office. And hopefully they recognize it. Hopefully their practitioners recognize it, that they need to come in, not do a telehealth visit. But I don't know. What do you think? What percentage
Well,
do you
I
think
mean, look,
people are?
I guess, when you turn on the news and you see, constantly the media and stoke fear, I think there's a percentage of people that just cannot handle that. So there is definitely going to be a percentage that just are fearful. That doesn't mean that they don't need services. So I think this makes your message even more powerful, is that as long as it's kind of like a reality that we're going to have to live with, it's something that we're going to have to like just say, okay, how do we handle this problem? Because you can either say two things about it. It's like, well, I'm just going to lose that patient, or you can figure out a way that you can get compensated and deliver something to them, because something's better than nothing as far as I'm concerned.
Yeah. And look, the reality is that some of that fear is maybe overblown, but some of that fear is legitimate. There are definitely patients who shouldn't be going out in public. If their health is compromised in any way, if they're elderly, and PT we're treating a lot of elderly patients in most practices.
Yep.
So we need to accommodate for that for sure.
Makes sense.
Yes, thank you. I'm telling my clients that they better be prepared for a reality where at least 20% of their practice will occur remotely.
Wow. That's amazing.
And regardless of the numbers you're currently doing, 20% of your pre-COVID volume will need to be via telehealth a year from now. And look, most of my clients right now, they're 50% or more telehealth right now. And, they're not back up to the same numbers that they were pre, but post-COVID, I still expect, and whatever that means, who even knows what that means, right? It's not going to be like we flip a switch and everyone's going to start rushing into our practices, like you're saying. So think about this a year from now. So May 1st, May 15th, whatever, next year, you're going to have to be at least 20% remote and beyond. I think it's a reality. And part of it is just going to be the consumers actually demanding it. People are going to want this. People are getting accustomed to doing their healthcare by telehealth, doing it remotely.
Yep.
Well, I'll also say that several of my clients have told me that their targeting goal of 40 to 50% of their practice to be telehealth.
Wow.
They appreciate the effectiveness, the efficiencies, the opportunities with telehealth. They're not closing their physical doors, but they also recognize that they just can't have the same kind of traffic that they had before.
Mm-hmm.
And that's gonna last for a long time. That's their plan. They will see patients in their office, but sparingly. I also work with a couple of practices that are 100% telehealth. They sprouted. They had this idea beforehand, and now they're going for it. They're building their entire practice around treating patients in multiple states via telehealth. So all you other guys out there, watch out, because they're coming for your patients, and they will take them if you're not up to the highest standards of remote patient experience, because they're building really professional level, high standard telehealth practices. Some of your patients will choose to do telehealth, so you need to be prepared also, right?
Yeah, so it's something you should get good at and understand and really implement it to professional standards if you're going to do it.
Exactly. Yeah. The past couple of months you could get away with a little bit of a rinky-dink operation, maybe not HIPAA compliant, maybe not the best headphones and microphone, maybe an occasional drop of a call, and patients would tolerate it. But I think you're going to see some high-level care and patient experience through telehealth in the coming months. And I know it, as a matter of fact. I've already seen it. So much like any new project, it's necessary to understand where you are and where you want to be. Fortunately, this is a marathon, okay? The marathon of practice ownership. And Eric, you certainly approach things in that way, right? You present things, people have to be looking towards the long term. So there's no defined finish line. So I adhere to the continuous improvement cycle model. And next slide, please. And this is the basic components of it, but I look at it this way. It's a cycle, right? So you as a practice, you need to assess what your needs are, what your resources are, and the objectives of your practice. And I like to look 3 months, 6 months, a year, and then beyond that, 3 years even, where you want to be. Model it, plan it, take that information that you got from your assessment, right, and apply it to your models. When I assess a practice, I take the information in my assessment, apply it to my models for an effective, compliant, growing, successful telehealth PT practice. And then that becomes our action plan and our training. So next step, we implement the plan by communicating it to staff, patients, referral sources, your entire community. It's going to be 20% of your practice, right? So it's going to take an investment of time and effort to get there. And everybody needs to buy in, right? Each participant, patients, doctors, will need to be educated on how it's going to work. And if they don't understand, they won't buy in. But if they do, then it's easy. Then it happens by itself, right? If the major players in the whole picture, in your picture of your practice, if they understand what telehealth needs to be, that it needs to be 20% and how it's going to work, they'll make it happen automatically. Thank you. So the most important thing is that whether you're performing an evaluation or treatment in any type of practice, right? It's most important that you, your practitioners, your staff, that everybody understands that a telehealth encounter is an actual visit. It's the real deal. You're actually treating that patient. You're actually evaluating that patient. You're actually having an effect and being effective, right? So, and that takes training. You have to get good. Everybody has to know what they're doing. And once that happens, your story becomes easy. Now, the practitioners can say, look, I'm having great success with my other patients. They can say this to any patient. I'm having great success with my other patients by telehealth. You should try it. And the front desk says, John's doing amazing things by telehealth, and all his patients love the telehealth visits. You should try it, Mrs. Johnson. So that becomes part of your overall story. As long as everybody understands these are real visits. You're not doing home exercise program reviews. You're doing real interventions.
Mm-hmm.
So each level of your organization needs to be on board, understanding that it's a significant part of the practice, right? And every patient or intake or potential is a potential telehealth patient or client. And it needs to be part of your conversations within the practice, like building on it and reassessing it and making the telehealth component of your practice better on a regular basis. So, that might involve improving your technology or, doing patient satisfaction surveys on how it's working. And everybody needs to be involved in that conversation within the organization. And then, of course, your external marketing, where you're going out to the public, you're speaking to patients, you're speaking to your referral sources. You want to incorporate telehealth into all of that, right? You're doing these things on a regular basis now, make telehealth part of that conversation. So one thing I like to tell practices is find doctors in your area who are also doing telehealth, right? Now they'll speak your language, first of all, and their patients are going to be more likely to do telehealth visits with you because patients are already oriented and they understand. Put links on your website to schedule telehealth visits and offer convenience of next day or even same day evaluations. That's huge. People like convenience and access. If you can offer that, you can do that by telehealth. It's a lot harder for an in-office visit, right? So you're offering a whole new level of service to your patients. Add videos of telehealth visits with consent, of course, to your website and offer how-to webinars for doctors and patients. Just showing them how easy this is, how it works. That visual connection will definitely go a long way towards increasing their comfort with telehealth and just smooth everything, make everything smoother for the practitioner once they actually do a visit, right? You can also expand your reach beyond your local area. You can go within your state. That's totally that's easy because you're licensed. Your practitioners are licensed within your state. But you can also start thinking about practicing in other states or offering services in other states. If you live in a border state, and maybe some docs on the other side in the adjacent state, or if you have a network of people outside of the state and a means of connecting to them. And look, the internet makes things easy. So marketing can be done nationwide pretty easily. PTs need to be licensed in the state where the patient is. Mm-hmm. Okay. It's a little bit of that's sort of a debatable issue right now. It's a little there's unclear answers really if you can treat without a license in another state at the moment because of the waiver of the relaxation of HIPAA regulations. And I get this question all the time, particularly in New York, where people from New Jersey commute into the city and they do their PT in the city. So PTs are asking, can they treat their patients who are in New Jersey? At the moment for PT, I've gotten different answers, but I'm sticking with no, you can't unless you're licensed in New Jersey. Okay, so you need to be licensed in the state where the patient is, or if you're licensed in if your profession has an interstate compact. So PT has a PT compact where I think there's 20 or 22 states in the compact. New York is not in it. Eric, sorry, Florida's not in it either. I was on the phone with someone in Chicago today. Illinois is not in it, but I believe there's 22 states. And if you're licensed in one of the compact states, you basically can treat patients in other states. You can treat patients in other states without a license in that state. You get, it's essentially a permit to treat in that state once you go through the compact procedure.
Hey, I got a couple questions. So let me just ask them. It says, one, are your practitioners having to get amendments to their insurance contracts to include telehealth? Would you be able to answer that?
Mostly, no. I haven't heard that. I heard it once from one practice that was in Missouri. Their professional liability coverage required an amendment to it. But most liability coverage covers physical therapy, at least. I'm not sure about other professions. I haven't heard anything with other professions. Okay,
and then it said, can we treat in another state if it is all self-pay, no billing info given?
No. Okay. You need to be licensed. If you are treating or practicing as a professional, you need to be licensed in the state where you're treating.
Got it.
But that does bring up another point. If you are treating in another state and you are licensed in that state and you want to bill insurance, you need to be credentialed with that payer in each state where you're doing it.
Got it. So everyone that's on, you guys keep asking questions. I know some of you ask questions, and I promise we will get you your answers if I can't read them all at this point in time. But I know that from a time standpoint, we want to get through the rest of this presentation. So we'll go on to this next slide.
By the way, there are other compacts too. It's not just physical therapy. There are multiple compacts, including an interstate medical licensing compact. So a few docs out there, and it's more than just the 22 states. I believe there's like 48 states in the IMLC. So providing effective care, and look, I'll tell it from the PT side because that's what I know best, but this applies to a lot of medical professions and other professions, right? The most important component of selling your telehealth practice to docs, to patients, to anyone else that you're talking to is the value that you bring, right? You're telling them, you're making it clear to them that it's not going to be a significant difference doing a telehealth visit versus an in-office visit. And that's because the value of a PT in particular is their knowledge, problem-solving skills, their compassion, and their communication. So the tactile component, the touch, which we all value so much, and so many PTs have said to me, I can't do telehealth because I'm a manual therapist. What they're not recognizing, and many have, so many have come back to me and said, I get it now. Like, I do a lot more than just touch the patient. I do a lot more than just manual therapy. I do a lot more than just soft tissue mobilization. And the patients appreciate it because we take a lot for granted. We think everybody knows a lot of the things we know, and our patients really don't. I mean, you ever go to a gym and watch somebody who has no idea what they're doing at a gym? You just kind of like, every PT is like, my God, if I could just get my hands on them, not literally, but, if you could just help them. And that's what we're doing. We're helping people. And it's even more complicated if they have an injury or, they're recovering from surgery, right?
Yeah. A lot of it has to do with your own intention too. I mean, if you have the intention to get somebody well, I mean, it's, obviously it's better when you have someone physically, but if you have the intention to really help somebody, that communicates to them too,
Sure.
So I think there's something to be said with that as well.
Absolutely.
Do you mean to go to the next slide?
Communication is key, by the way. Communication is, a lot of PTs at this point of their career have to, whether they're early stage or even later stage, they're having to hone their communication skills. And that's a scary proposition to a lot of people, because now they have to speak more than they were accustomed to. We communicate in so many other ways, right? But we're generally pretty good at it. PTs tend to be good communicators. I mean, not everybody, but most PTs are really good communicators. There's other ways to communicate besides just verbal, but
Another question says, what is your advice if patient's health insurance does not cover telehealth?
I'm sorry, if their insurance doesn't cover telehealth?
Yeah, if their health insurance does not cover telehealth.
Right. I mean, there's always other options. They certainly can pay out of pocket. You can do a payment plan with them. You certainly can you can do it over time, or a subscription program. I'm going to talk about that a little bit more. There's lots of options for patients.
Anybody like that's doing this from on a cash-based services, like what's the amount that they've been charging? Like any?
There's no real consensus on that, but I tell people that you should be charging the same amount that you would for a normal visit. If it's the same, you're spending the same amount of time and you're bringing value to this patient in the same way, then at least start at that point where you're starting at the same rate where you do in office. A lot of people are doing that. Some have come down. Some have come down a little bit, but I think similar rate to what you would charge for a cash visit in your office.
Good. You got a fan here, Kimberly Carpenter. Definitely.
Oh yeah.
Said that definitely give Daniel a call and use his service. He knows everything you need to know, and his system will walk you through step by step, so you know nothing will fall through the cracks. So there's there's a good plug there.
And by the way, just to get back to your last question, Eric.
Yeah.
Recognize that not only are you as a practitioner being effective in helping the patient achieve their goals and the same reasons why they come into your office, but you're also offering convenience and service, and it's very one-on-one. It's very, it can't get much. It's very intimate to do something like this, a one-on-one session with a patient. But it's also very effective in that way too, because you're really connecting with them.
Yeah.
So don't devalue that. A lot of PTs think that because they're not in the same room as the patient, they can't charge as much. And I beg to differ on that.
I agree 100%.
Yeah. We can go to the next slide, please.
Okay.
Thank you. So right now, the rules are pretty lax, right? You can use a non-HIPAA compliant platform, and you don't have to abide by the strict guiding set of rules of telehealth. But as we said before, this is not going to last forever. Certainly that the regulations in the emergency state is not going to last forever. So maybe till the end of the year, maybe. We don't know, but maybe. But because of that, you need to get your house in order. I mean, you need to get your telehealth program, you need to get it organized, and you need to document everything.
Yes.
Yeah. So if your telehealth program was audited right now, which it's not going to be tomorrow, but it could happen in the next few months or so, are you prepared to comply with federal, state, and local telehealth regulations? Do you even know what they are? Are you following the best practices to maximize return on the ROI on your telehealth program, right? Are your forms and documentation compliant? Think about these things, right? And are you billing and coding appropriately and effectively? And that's something where you can really be maximizing the reimbursement you're getting. So, are you doing that? Here's my shameless plug for my policy, our policy and procedures manual. And if you use the coupon code ERIC, E-R-I-C, I said that right, Eric? E-R-I-C.
You got it. That's right, man.
You'll get a 20% off the listed price, and it's comprehensive. It covers all the topics above for anyone looking to build their telehealth PT practice on their own. Okay, if you're doing it on your own, if your practice has decided to go it on your own and you haven't really documented it yet, it's right there for you, and you can tweak it. It's an editable document. So if you work with me as a consultant, we give deeper discounts, and we can discuss that on a call. But the point is, you will need a documented telehealth P&P manual for the future of your practice. You probably have a policy and procedure manual for your practice. have you incorporated telehealth into it? And is it comprehensive? And is it covering all your bases? And is it really protecting you, which is what's most important, right?
Yeah. This is the area when it comes to compliance that I see where a lot of practitioners get in trouble. And when, so it's either you can do it right or you can do it again. So I would say if you're going to introduce something like this, do it right the first time. Make sure that you understand the compliance or have someone that does it professionally, because the last thing that you do is you want to be doing something wrong and then all of a sudden an audit comes and you're like, we already see how delicate a private practice can be when you're not seeing patients. So, you don't want to add in the legal and the compliance aspect to it. So I would just encourage everyone just to do it right the first time.
Yeah. And, this manual it's basically done for you. We even let you plug in your information through an online form, and it populates the whole thing. If you want to tweak it after that, there's there might be little tweaks that you need to throw in there, but for the most part, it's populated with your information as you want it to be.
Okay, cool. So they just go to your website, teleptsolutions.com.
Yes, and it's on the shop page. Please wait till this webinar is over. I haven't put the discount code in yet.
Yeah.
But as soon as this is over, the first thing I'm doing.
Okay, cool.
Yeah. So when you talk to your payers prior to doing telehealth visits with each patient, be sure you know what to ask, right? And you should be asking about, and they're all different. Of course, insurance companies couldn't just be like, all right, we're all going to do things the same way. They don't. They all accept different codes. Some payers are not paying for telehealth, as one of the questions was asked. Know what modifiers they want to see, know what place of service they want, and also understand if the patient is going to be responsible for their co-payment, deductible, co-insurance. A lot of payers are waiving that at this point for now during the emergency time. And that is supposed to mean that they're going to cover it. I have definitely heard about payers who are not covering it. They're telling you that it's okay for you to waive the deductible or waive the co-insurance or co-payment, but they're not going to pay it. So check with each of your payers. Make sure you know what you're getting into. Make sure you're transparent with your patients. I think that's always important. And be prepared to bill appropriately. Patients who pay cash will likely want a super bill. So you still need to know how to code. And Medicare, of course, has their own set of regulations for paying for telehealth visits, which they do now. They pay for telehealth visits as of March 1st. So, of course, look, when I started doing telehealth, there was no COVID emergency. I was looking for opportunities. I was looking for ways to build a practice and help a practice take advantage of this new technology. So first off, we started with covering up for cancellations and no-shows. So anytime a patient would cancel a visit, we'd say, no problem. You can't make it in, your kid is sick, your PT's free now, so let's do a telehealth visit to make up for that. There you go. And that's, if you can reduce, I'm sure most practices, if you could reduce your cancellation and no-shows by 50% by doing telehealth visits, that's a win right there, right? And you can do lots of other things. You can do group programs, much like you might do a group exercise program in your office, which some practices do, but I actually think it's even easier and better to do it by telehealth, because now you get a group of people. They don't even have to all come in. They basically just have to log onto their into your portal, into your telehealth platform, and you can do an exercise class or a group program, Bill 971150, with a PT for your chronic pain patients or your Parkinson's patients or your back pain patients. Great way to connect with people, and they don't have to come out of their home to do it. So you could do it at like 7 or 8 o'clock at night. It's a nice or early in the morning. Nice little thing to do. Subscription programs. A lot of practices are looking into this now. Ways of offering services to their patients without them having to pay through their insurance company. I mean, a lot of payers are now a lot of insurance coverage. They have deductibles or they have co-payments of $40, $50, $75, right? I mean, patient might as well be paying out of pocket. And you can, and they can do that, and you can certainly do that with telehealth, but you can, if you offer a subscription program, maybe it's like one in-office visit a week, one or two telehealth visits a week for a fixed fee. And you do that as a monthly subscription. I think that's an awesome model. And I think everybody should be looking into some form of doing that. You can also outsource, whether you're outsourcing or insourcing, and meaning like if you have a specialization practice, if you're a women's health practice or you're a women's health practitioner, you can outsource those services to other practices. PT practices are always looking for specialists. They're always looking for hand specialists, for pediatric specialists, for women's health specialists, and it's an opportunity to connect with other PTs from either side without having to travel, right? So, home visits also has definitely delved into telehealth, home care in certain capacities. And a lot of offices are looking at retail right now. Your patients are home, and either they have some equipment or they don't have some equipment, but if you can set them up with the right equipment to do telehealth visits, you can really maximize the value that they're getting out of it. So, putting retail on your page or going through and I can talk, if anybody wants to discuss that, I have something that I'm working on to make that happen, make it really easy for practices.
Yeah, everybody kind of stay tuned, because I'm going to give you guys an offer where you actually meet with either one of us. You can do, a free 15 to 30 minutes, or just hang on with me and we'll make that offer to you guys here in just a second.
Yep, this is my last slide. So
okay, cool.
RPM, that's just the reminder slide. RPM is remote patient monitoring. Let's go back to the last one. Okay. Remote patient monitoring, and there are companies right now that are working on models for remote patient monitoring for PT, and whether that's incorporated into your current visit, or it is simply just check the stats or check the readout from, a patient might have a device at home that measures their knee range of motion after they have a total knee replacement. And PTs, you as a PT will, on a daily basis, hourly basis, monitor their activity level, their range of motion, any other things. So that's something it's sort of on the horizon. It's not happening yet on a very scalable level yet, but definitely coming. And store and forward, a lot of states are paying for store and forward, where a patient can send you a video of themselves, or you can send a video to them. It doesn't have to be a live encounter. So that's something I think a lot of practices should really be thinking about right now, because that's a way to create efficiencies and still provide value to your patients in a very effective way. I mean, really effective. And talk about access and convenience. You don't even have to be on at the same time, and you can provide a customized. Some people think about this like, the patient is going to watch a video. It's not just a video. It's not like they rented something that they found, or went to YouTube and just found something. It's coming from you, who knows them well. You're progressing their program, their specific customized program. And I think that that's going to happen very soon for a lot of practices. Store and forward.
Amazing, man.
20%.
20%. Yeah. Get used to that. Yep. So, and I think this is what we've been talking about, right? There is a reality here that when it comes to recovery, that everyone's going through this recovery right now. Once you guys stay with me, there are definitely some things that I need you to do when you come back. That, and I see it in our office right now. You have to make sure that not only are you starting to look at like other income streams that you're going to provide, but you really got to get that culture back. You really got to make sure you get that purpose back in the organization. Make sure everybody knows the product of the organization. Go to all your staff and just remember, hey, this is what we're doing. Just because we were off for 6 weeks, 7 weeks, 8 weeks, doesn't mean that what we're doing here isn't really super important, if not now more than ever, right? So I would encourage all of you owners out there to make sure that when you're going back to your business, you get that culture back. That's really going to be key. Make sure that there's new safety protocols, put them in writing. Have a game, make it a game. A lot of people are, this whole anxiety and fear and such, no one's playing anymore. It's like, it's too serious right now. So you got to make it a game inside of your practice, and, definitely start and promote, make sure it's well known. Like I'm thinking about, like, I want to go to this place. Are they open? Well, if they would have been promoting and letting me know that they're open, I wouldn't have to think about it. Right. So when it comes to your practice, make sure everybody knows that you are definitely open for business and you are ready to do some business and you want to help people and you want to see them. And then from a financial perspective, look, I talk about it all the time. If you're going to run your business like an entrepreneur, like a businessman or woman, then you have to make sure that you're putting your profits first. It's actually the least selfish thing you can do. Because if your business is not solvent, if there's not reserves there, then there's not going to be an organization that you can go back to and you can't help people. So it's actually having reserves, putting your profit first. It is the most important thing that you can do to make sure that not only your business, but your household is in good financial shape. And so I want you to have that mindset. And then, make sure that you have a good coordinated financial team. And if you don't have a plan, get a plan. Right now, not having a plan is deadly. Not having a plan for getting out of debt and paying less in taxes and having, pools of money there, it's deadly. It's not like something, I'll worry about it next month. You can't do that right now. I think if anything that we've learned over the last 6 weeks is that how delicate our businesses are if we're not seeing patients. And it's just something that you can't take lightly anymore. So you have to make sure that you really put some emphasis on that. So we're definitely here to help. I want to make sure that you guys see the offer here at the right-hand side. I don't know if I have to hit publish on here or not, but basically it's this. Let me see if this works. Yes. So I'm offering 30 minutes. If you want to talk with me, I think Dan's offering the same thing. So just click the link to the right of your screen and let us know if you want an appointment. I'm going to offer 15 to 30 minutes and we can talk about anything you want to from a financial perspective, your debt, the PPP loan, what you're doing with your practice, what you're doing with your personal finances, whatever it is right now. There's a lot of uncertainty. There's a lot of unknowns. There's a lot of, I can tell right now, I can see everyone, all the I don't knows, the financial I don't know. So you don't want to hang around with that. And if you have any questions about TelePT, look, Dan's the man on this. He obviously knows this area very well. He's offering, to talk with anybody for, a 15 to 30 minute phone call. Take advantage of that. It would be neglectful not to do that, because this is something that I think everyone's going to have to at least look at and add or understand it because of the fear that's being created right now. So I would definitely encourage you all to take advantage of that offer and, click on the right of that on the screen. And, we can set an appointment where you're talking to either one of us about, anything that is related to, what we do for a living. Anything else you want to add on that, Dan?
No, I am eager to talk to anybody who has questions. I see that we didn't answer all the questions here. So
yep, I got some more. We got a little bit of time if we want to.
You want to do a couple? Okay.
Yeah. Okay. What kind of liability exists for telehealth evaluations when we don't have the tactile component?
Look, I guide my clients to be safe first. I think that's really important. I mean, first of all, you're a professional, so use your professional judgment and set up a safe environment for your patient in all situations. Your liability insurance should cover it. And by the way, check with your liability carrier to make sure. Don't just assume that they're covering, but most liability carriers cover telehealth. If they cover you as a PT, it's PT first. Doesn't really matter where it's being done, but check with your carrier. So the question was, what
kind of liability exists for telehealth evaluations when we don't have the tactile component?
In terms of, I assume that means in terms of treating the wrong thing or not doing an accurate assessment. Err on the side of caution for sure. I don't think the liability is no different than in the office. There's no. Yeah. I mean, the liability is no different than the office. Use your skills. Use your problem solving abilities. Use your resources as a practitioner to understand what's going on with the patient. And as I said, be cautious. You're not there if something were to happen. And of course, set up a safe environment, but also absolutely have an emergency plan in place. With every patient, you should have their phone number. You should know where they are, if it's their home address or not. Definitely know where they are. It's always safest if someone is there with them, particularly if they're at risk in any way. And definitely for a minor, you should absolutely have an adult there with them. So those are some liabilities, but know the plan and communicate that to the patient.
Yeah, definitely, guys. This is an area that's so complex. You need to get a teleconsult right now with Dan. So make sure that you guys are clicking on the right there and get an appointment so that you guys can clear up all these questions that you have. Here's another one that we said. It says best platform for a solo practitioner. I'm not quite sure what that means, but can you answer that?
Yeah, I mean, I think what the person's asking is, as a solo PT, if you're practicing on your own, there are plenty of very good platforms out there that are very easy to use. I know that Doxy is a free platform. It doesn't have all the bells and whistles, and may not perform at the highest level, that a more advanced platform might have. I tend to use, I work with the people at Better PT a lot. I know their platform. I know them very well, and they have an awesome, very easy to use platform. Look, the most important thing is that it's easy to use for the practitioner and for the patient. And the patient has to be able to get on to a visit very easily and not get discouraged. They also need to not get drops from a call. If that's happening, they're just gonna say that telehealth doesn't work, right?
Yeah.
So it has to be a reliable platform that is easy to get onto. And I'll say Better PT again, just because I like them. I personally think that they're the best thing going.
Makes sense. Here's a question. It says, what type of outcomes are practitioners getting compared to in-clinic? And what are the payer data outcomes that are being generated to understand the difference in outcomes versus cost? I don't know if I totally get that, but does that make sense to you?
Yeah, it makes sense to me. That's a great question that has not really been answered yet.
Yeah, it's a little too soon. I guess too soon to tell on this.
Too soon. But it is definitely, it's a very relevant question, because payers are definitely looking at what we're doing right now. I look at this as, this moment in time is definitely it's a proving ground for what we do. And, we as professionals need to prove that we're not going to take advantage of it and overutilize it and, not act like little children, because we're not. We're professionals, and we're doing our best to help patients achieve their goals. Now, is that possible? Is the ability there? I sure hope so. Better trained PTs who are competent and effective at telehealth certainly are going to get better results than those who are just winging it, right?
Yep.
And I think what likely will happen is payers are definitely going to look at this, and whether they start scaling their reimbursement based on outcomes for telehealth in particular. Maybe they might do that, but they're definitely paying attention to this moment. Medicare as well, CMS.
Yep, they are. You got to get this right. You got to get your money right. You got to get all this stuff right. There's just no margin for error anymore. Yeah. So because of that, guys, again, we're definitely here to help. Make sure you schedule with us, either one of us. If you have questions in regards to your personal finances, your business finances, I can certainly help you with that when it comes to offering TelePT. And really, regardless if you're a PT or a veterinarian, you can help a lot of different types of practice owners, Dan, in that respect.
Yeah, absolutely. Okay. So yeah, I've worked with some physicians. I've spoken with some dentists. I'm not exactly working with them yet, but certainly could happen in the near future. I see dental as a big opportunity in telehealth as well.
It may be. Here's another question. Do you write your notes in a similar fashion and bill the same, i.e. 97530 for telehealth?
You can bill it depends on the payer, but for the most part, most payers are accepting typical PT, CPT codes, and that goes for other medical professions as well, your typical codes. Documentation should be in your EMR, just as if the patient was in your office. You do need to include some other information in there, particularly that you got consent, that you had an emergency plan in place, that the visit was done with where the practitioner is and where the patient is, right? So it wasn't done in office, it was done via telehealth. a two-way secure platform it's in your policy and procedure manual.
Okay, so you have all that taken care of then.
Yeah, of course.
Let me see if there's any more questions. How are you handling doing both in-office and telehealth at the same time? So
that's a great question.
Yeah,
that's a great question. And I think that's really, it's important because that's going to be the future of what your practice is going to look like. Most importantly, don't flip back and forth from telehealth to in-office for every visit. My recommendation is to create blocks of time in your schedule, and that doesn't always work out to perfection. You might have to adapt a little bit with on certain days. If you have an opening during your telehealth block of your schedule, and a patient walks in, or vice versa, the patient calls in while you have a block in your in-office. You have a space in your in-office block of time, and you could potentially do a telehealth visit. That's fine. I think you should make that a rarity, though. I think it's really important that not just for you as the owner, but for your practitioners. I mean, it can definitely be confusing, first of all, and it's definitely inefficient to be going back and forth between telehealth and in-office visits. So create blocks in your schedule for telehealth and for in-office.
Yeah, amazing. A couple other people said,
think about that 20%, right? So 20% of your schedule.
Yeah, it really is. It's going to be something that I think is going to be so important going forward. Said here, someone said, we have been doing this successfully, and we are at full capacity, half clinic and half telehealth for the past 6 weeks, and making all appointments 45 minutes. So look, it can be done.
That's awesome.
It can be done. It has to be done, and I think you really have to take a look at it. So again, guys, last pitch here to make sure that you take advantage of this offer. So at the right of your screen, you will see it. It's going to have the click here for a free consultation with either me, and I'll talk to you about anything about your money that you want to. Debt, taxes, protection of money, all those kinds of things that I'm an expert at. And then Dan, of course, can help you with the TelePT Solutions as well. So Dan, that was awesome. I mean, you kind of blew my mind on some of that, like some of the things you're saying. I'm like, holy crap, man! This you definitely need an expert to guide you through on some of this. But that was really incredible. So thank you so much for doing that, and I definitely appreciate your time.
Great, thank you. Thanks for having me on.
So okay, everyone. So we'll be back next week with some more incredible content, and I just want you guys to know that. Well, I want you to, number one, stay aware. Stay vigilant, and then make sure that you stay courageous and stay focused at the same time, because there's definitely some opportunities out there, and I want to make sure that you guys don't let whatever is going on out there affect your attitude, because your attitude towards your money and your business will dictate your success with those two endeavors. So I'll see you guys next time. Thanks again, Dan.
Great job, Eric. Thank you.
All right, see you.